This afternoon I'm talking to Doctors Matthew and Jane Gray at their general practice surgery here in Camden. So could you tell us a little bit about your professional lives as general practitioners?
So what I do enjoy about my days as a GP are that they are varied, rarely monotonous, and they're challenging, rewarding. At the end of the day, I usually can go home and feel like I've made a difference to someone's life.
No, I'd agree with that. The ability to know that you've made a difference on basically every day to someone or someone's family through the work you do, and as you were saying, the variety, and the ability to teach the next generation. We teach registrars within our practice.
Are there areas of general practitioner work that deserve more recognition?
So one of the areas which I think GPs need more recognition and more support in is managing the elderly in our community, in community and in aged care facilities, the complexity of their illnesses, and then the elderly in their last days and giving them dignified ageing, which for GPs isn't well supported or rewarded because of the complexity of it, and Medicare doesn't help sustain doctors attending aged care facilities and taking the time which it takes to really manage these patients as they deserve.
What do you think are the biggest hurdles facing GPs in your region?
In many ways, this is a really good time for general practice, and I think but at the same time, it's a good time because of some of the hurdles that are about to face us or are facing us already. As Jane's mentioned, we've got an ageing population, but also a lot more in the way of chronic and complex disease. It seems the hospitals aren't in a position to service the need in those areas, and so I think there's more and more going to need to be done in general practice and primary care, and so that's an opportunity, but it also requires a way of doing things somewhat differently.
Well, in our area, one of the big problems is a lack of medical workforce, and we're hoping that will be addressed by our local medical school and the other medical schools, that soon we're told there'll be a huge number of recent graduates hit our region. We're hoping so because at the moment we haven't got enough GPs to cover the basic population which is here, but this is the area which is expecting a massive growth in the next 10 years. The patients are coming out of hospital much sicker, much earlier, very quickly after major life-threatening events. They return to their primary doctor, and so GPs are now being faced with patients very early in their journey with new illness, which can be a challenge and very time consuming for the GP, again, which isn't particularly rewarded through Medicare.
And do you have any ideas about how these hurdles might be addressed?
Really, because I think more and more care is going to need to be done in the community, and that's actually backed by the international evidence that says, health outcomes for a population are better the higher the quality of care in the primary care setting. So what it may mean is that, as I've mentioned, because of the quantity of work, that we're going to have to engage the use of other professionals and the skills they bring in a more integrated and coordinated way. However, because of the training and the expertise that GPs bring, I'm sure there'll always be a role, and a central role, for the GP in those teams.